we're really happy to have Dr. Amy Dickey Yeung with us. She recently got married, so she's no longer just Dr. Dickey to us. She is a porphyria expert. She has many of our patients that are actually here with us today are also patients of hers as well. Let's make sure that we enjoy this time together and that we are able to get all of our questions answered to the best of our abilities here today. So, with that, let me kick that over to Dr. Dickey Yeung. Go ahead and take it over, introduce yourself, and then we'll go into your slides then.
Hi, everyone. It's very nice to see everyone today. Perfect. Hi, everyone. It's good to be with you all. As Myra said, I'm Amy Yeung now. I just got married November 1st. And I co-direct a Porphyria Center at MGH, and I also have EPP myself. So liver transplant and liver issues has been something I've thought about for a while because of the risk in EPP. Here are my disclosures. And just for an outline of today, first I'll start with an overview of the porphyrias just for background. Then I'll talk about EPP and liver transplant and AHP and liver transplant. Those are the two groupings of porphyria that typically have liver transplants. It's not the only ones. I know there's others here with another type of porphyria with a liver transplant, but these are the two groupings of porphyrias that is thought about more often. And then there'll be questions, discussions. I think we'll hear from other patients before questions from me. Is that correct, Myra? Great.
That is correct. We'll go through the slides first and then we'll hear the patient testimonials right after.
Okay, perfect. So first of all, porphyrias are defects of heme synthesis, but what is heme? Heme is a pigment molecule that carries oxygen on red blood cells. So here on the right is heme. It has iron in the middle, and then one molecule of heme carries one oxygen. And there's the hemoglobin protein that carries four hemes. And then there's the red blood cells that carry a lot of hemoglobin molecules. So the body use red blood cells packed with hemoglobin with heme on top to take oxygen from the heart to the tissues to give oxygen to the tissues. So it's a very important molecule in the body. And the body takes glycine and succinyl-CoA, two substances, through a series of 8 different steps to make heme. And with each step, if there's a problem in one of the steps with porphyria, some of the intermediates can overflow, kind of like a dam, as you see here. And in the porphyrias, it's not usually a problem of too little of the end product, but some of the overflowing products in the middle. Because heme is so important in your body, the body is very motivated to have enough heme. But in porphyrias, there can be overflows of the intermediate substances. And some of the early products are nerve damaging, neurotoxic intermediates, and some of the later products are light sensitive. So for different types of porphyria, some may lead to nerve damage, some may lead to sunlight sensitivity, depending on the type of porphyria. And some there's different intermediates that build up that can have both properties. And here is the full pathway, so 8 different enzymes or steps in the making of heme, and then in blue are the different enzymes, and then red are the different types of porphyria, each related to a different step. And the three most common types of porphyria are acute intermittent porphyria, porphyria cutanea tarda, and erythropoietic protoporphyria. And they essentially have almost no overlapping symptoms. And some of the other types of porphyria can be thought of as having combinations of symptoms of the three most common types. So I like to go through these first. With acute intermittent porphyria, patients get intermittent episodes of abdominal pain, nausea, neurologic issues, seizures, and it can be provoked by things like medication, diet, stress, hormones. In porphyria cutanea tarda, patients get the slow onset of blisters and scarring on sun-exposed skin. Some patients don't notice that it's even related to the sunlight because it happens so slowly on sun-exposed skin. And then with EPP, patients develop painful light sensitivity beginning in infancy, typically with swelling, redness, and sometimes with burst blood vessels. Patients learn very quickly that's the sun causing the problems because it's, soon after the sunlight exposure, and patients have a lot of pain with sunlight. And these are the two main groupings of porphyrias. Some of the porphyrias, about 80% of heme is made in the bone marrow for blood and oxygen um, to the tissues, but actually 20% of heme is made in the liver for a variety of different proteins that process different medications or different toxins in the body. So the hepatic porphyrias are related to heme made in the liver. And the erythropoietic porphyrias, EPP, XLP, CEP, the heme made in the bone marrow is the important uh, type, important place. So in the hepatic porphyrias, the liver transplant will cure the disease, which we'll talk more about later. And then for the erythropoietic porphyrias, a bone marrow transplant will cure the disease. A liver transplant may be necessary for other reasons, but it doesn't, liver transplant doesn't cure EPP. And in the different types of porphyria, there's liver involvement of different types and different ways, and which can be a little bit confusing. So I'll go through that. And EPP and XLP, it's not the liver that's the initial problem, like in the acute hepatic porphyrias, but in EPP and XLP, the intermediate that builds up protoporphyrin is a really big molecule, that really big substance that the only way it's cleared is through the liver. Some of the other porphyrias, the porphyrins are cleared through the urine, but in EPP, because it's fat soluble, not water soluble, it's cleared through the liver, but it can also hurt the liver. And so patients can get both liver failure and gallstones. So in EPP and XLP, liver disease is a result of the disease. In porphyria cutanea tarda, the liver is involved too. A lot of times liver disease can be one of the main risk factors of the disease and lead to someone to get porphyria cutanea tarda. And also, if someone already has porphyria cutanea tarda, the inflammation in the liver from that can also further worsen liver disease. And then with acute porphyria, AIP, VP, hereditary porphyria, because the problem is in the liver, a liver transplant will lead to cure. Sometimes because of some inflammation in the liver, there can be a little bit of liver injury and liver scarring, but it doesn't lead to acute liver failure the way EPP does. You generally don't need a liver transplant for liver disease itself in AIP, VP, HCP. It's more a liver transplant to cure the porphyria itself. Also, with AIP, VP, HCP, there can be liver cancer, so sometimes liver transplant could be needed for that. And also, one of the main features of the acute porphyrias is abdominal pain, which sometimes could get confused with a liver issue, although it's not really arising from the liver. Well, I guess the porphyrins themselves are arising from the liver. Um, So I'll first start with talking about liver involvement in EPP and XLP. As I mentioned, protoporphyrin can only be cleared by the liver and it can damage the liver. And about 20 to 40% of EPP patients may have some mild abnormalities in the liver function testing due to the protoporphyrin levels being so high in the body. But about 2 to 5% get liver failure because if the protoporphyrin is damaging the liver and it can't, the liver is the only place that clears the protoporphyrin. Sometimes the protoporphyrin can go, when there's liver injury, the protoporphyrin goes up even further and damage the liver more. And so there can be pretty rapid liver failure in EPP. And when there is liver failure, there's basically protoporphyrin inclusions in the liver that glow under fluorescence, which you can see here. And sometimes, if it gets really bad, there can be essentially a black liver from all the deposits in the liver. So here you can see the protoporphyrin being made in the bone marrow, going in the blood, and then it's cleared through the liver where the protoporphyrin can hang out in the gallstones, but then it can also clog the ducts in the liver. So here you can see one of the liver ducts, and there can be protoporphyrin here damaging the tissue. And for EPP and XLP, when there is liver damage, there's different therapies that are tried. If there is mild to moderate problems, then there's a lot of screening to look for other causes. There are some medications that can decrease inflammation, can help clear, can help the flow of fluid through the bile, and it's important to get referred to a liver doctor and a center that does liver transplants and knows about porphyria. So often also imaging of the liver. But when there's advanced liver failure, then essentially liver transplant is almost always needed in EPP because once there's so much damage, the liver can't deal with the amount of protoporphyrin it has to clear, and the porphyrins go up and there's continued damage. So it can be a pretty dangerous situation. There can be things that we do pre-transplant to bring down the porphyrins, like plasma exchange, red cell exchange, hemin, but liver transplant is necessary for um, getting past the liver failure. So I'll share a case. A 42-year-old with lifelong undiagnosed light sensitivity presented with abdominal pain, yellow skin. Over the next 1 to 2 months, liver failure continued to worsen and worsen. All other workup was negative for anything causing it. A liver biopsy showed quite a lot of scarring. There was a doctor who thought of EPP and looked at the liver biopsy for these fluorescent inclusions, and they did show the fluorescent inclusions. That's when she was transferred to our hospital at MGH. Her protoporphyrin was very, very high, over 5,000 metal-free erythrocyte protoporphyrin, plasma porphyrins in the 300s. Genetic testing was positive for EPP. After many months, she received a liver transplant. She'd had plasma exchange, red cell exchange, hemin, was finally able to get a liver transplant, and now she's doing quite well, more than 1 year after her transplant. So here is a publication published a long time ago in 2005, but this is actually the most recent publication we have with showing a lot of US patients with EPP that had a liver transplant. Here's some of the demographics. It's 12 men, 8 female, average age 31, range from 13 to 56. And the protoporphyrin level was over 5,000, about exactly this is where my patient that I presented, the protoporphyrin was. And here you can see the UNOS data, which is basically the US average of how patients do after a liver transplant. And here it does show that EPP patients do a little bit worse than US average, but basically just along the trend. But this is also 2005 data, so liver transplant has changed quite a lot, and also EPP management has changed quite a lot. So it's hard to make a lot of comparisons to the 2005 data. Now I'll go to acute porphyria. In acute porphyria, there's a lot of things that are done for management. A lot of patients get hemin, gavocerin. A lot of these therapies are to decrease the production of heme in the liver. ALAS1 is the first enzyme that controls how much heme in the liver is being made. And both hemin and gavocerin can decrease that. A lot of times people get glucose, which also it works at the same place. and then symptomatic treatment, narcotics, fluid, electrolytes. But even with this, sometimes um, it's not enough, and patients may need a liver transplant. Liver transplant for AIP has now become a lot less common now that gavocerin can prevent attacks in a lot of patients. And here's one case from uh, the patient of mine, 38-year-old with polycystic liver and kidney disease and acute intermittent porphyria. Developed abdominal pain symptoms starting in college, but at the end of her first pregnancy, developed severe abdominal pain, diagnosed with AIP, had multiple attacks and chronic symptoms. She was started on prophylactic heme for quite a while, and her 2019 urine PBG was in the over 500. It wasn't normalized to creatinine, but still um, very elevated. First visit with me was in 2021 when she was on prophylactic heman. Her urine PBG at that time, the day she started gavocerin, was 29. She started on gavocerin monthly. Her abdominal pain improved, but not completely. Heman was able to be stopped. She did continue to have intermittent abdominal pain attacks, but normal PBG whenever she had stress or other illnesses. And she also had increased symptoms of fatigue, just not feeling well, essentially every month before she would get her gavocerin dose, but still the urine PBG was normal. Due to complications of her polycystic kidney disease and basically her liver getting too large and making it difficult to eat, she had a partial liver transplant from her sister early 2025. Her urine PBG and ALA normalized. Now she doesn't have any more abdominal pain. No, not doesn't have the fatigue, feeling ill, nausea every month. She does continue to have a little bit of neuropathy of her arm and leg that she thinks may be from, past porphyria issues. Here's uh, also in addition to AIP attacks, patients with AHP can have liver cancer, which may be a reason to do a liver transplant. Here's a study of in Sweden where there's a lot of AHP patients, and you can see here the risk of liver cancer in men here and women with AHP in this line, and then the national average is down here, so much, much higher than typical. And over here, it shows that if people have positive PBG, the risk is quite high, but if patients have AIP and PBG negative, it's down here where the baseline level was. This is a Swedish population, and basically in the data, the hazard ratio for for liver cancer and porphyria patients was in the 40s, which is sort of like 40 times normal, but still the overall risk is quite low still, but just a lot higher than people without um, AIP. And here's a study that looked at 38 liver transplant cases for AIP in Europe. Several different countries in Europe combined the data. And for this, 33 had liver transplants for AIP attacks. 13 had AIP attacks and renal impairment or neuropathy. Two for uh, liver cancer, and one for acute liver failure related to an accidental heme overdose. The age at liver transplant average was 37. Females more than males, as would be expected, since severe disease is more common in women. And here you can see in that data set, actually AIP patients did a little bit better than patients who were transplanted for other reasons. Here in the black was transferred for other reasons, and then AIP patients is this dotted line. This, was published in 2024, so quite a bit more recent data than the one I was presenting for EPP. The publication did say that those who had very severe neuropathy or kidney disease did do a bit worse than other AIP patients with transplantation. So overall, most people with porphyria would never need a liver transplant. If you have AHP, transplant is considered only for severe attacks that continue despite treatment. If EPP and XLP, transplant is considered only in cases of liver failure. Liver transplant may be helpful, but comes with a lot of risks. And a lot of new treatments have made transplants much less common in AHP, and also I think new treatments for EPP will make it a lot more less common in EPP pretty soon. So that's what I have, and I know the questions will come later, so I'll stop sharing my screen. Thanks.
Thank you very much for that. That is very intense. I'm sure that all the questions as they are coming in, some of them actually might be answered during the testimonials that we're about to hear. So thank you for that, Dr. Dickey Yeung. Really appreciate it. Let's go ahead and kick it off with the very first testimonial. This is actually a CEP patient that underwent liver transplant. So Casey, please take it away. Give us your experience.
Hello, everyone. Yeah, um, sorry, like previously said, I have CEP. I first realized, or my symptoms first came about, in January 2022. I vomited a large amount of blood. Weren't aware of any liver issues prior to then, and I was, taken to the hospital. They did tests and placed me on diuretics to decrease the fluid that was building up, because of veins that were, like decreased in size. So like the porphyrins weren't able to be processed. Um, so there was a lot of buildup and hypertension, etc., which is what caused the blood that I vomited because of varices in my esophagus due to the buildup. Um, in June 2022, I had a TIPS procedure where they basically placed a stent in my portal vein, that was like part of my liver or outside of the liver, and that the goal of that was to open up that vein to allow the hypertension to go down and for my liver to be able to process the porphyrins. But after a few months, it wasn't that effective. Well, after we waited a few months, that ended up not being very effective for me. So then, about less than 6 months later, November 2023, um, I received the liver transplant. The TIPS was done in June 2023, and then I received the transplant in um, November 2023, the beginning of November, and that was from UPMC in Pittsburgh. They have that's where I went for all of um, my liver issues. That's the team that took care of me there. And I had a doctor there that saw me a couple months prior, went through all of the whole process there, evaluated me, gave me all of that information, and as well as NIH, the National Institute of Health. They gave me more information as well. And we ultimately decided that after genetic testing, I should say, the only real evidence that they could find was causing my liver issues was because of CEP. The genetic testing didn't show anything else that was going on. It's a little more rare in CEP, but that's really all they could figure out. So we just went with that, and um, I got a living liver transplant. Pittsburgh and Dallas are the only two that I'm aware of or that was available in 2023 to do the living transplant. So that is what I did. An anonymous donor back then. I since then, oh my goodness, I have then talked to the donor or at least messaged, but it was anonymous. Donated a portion of their liver. I received a portion of their liver and stayed in the hospital for about a week I was pretty quick to just thankfully happened to be pretty quick that I didn't have to stay there for very long. Normally it's over a week, leaning towards 2 from what they told me. And normally the person would be in the ICU for longer. I was only in the ICU for about a day and then went to the regular liver transplant floor. Um, I don't know how much you want me to get into for like the exact what actually happened. I had about 4 IVs throughout the process. And then I think it's called a JC maybe, um, like drain that was connected to like the inside of my liver somehow. I'm not positive on that part, but basically just draining out all of the blood and all of like the I don't want to say trauma, but like the trauma that was caused to my liver. It was draining out all of that excess fluid and blood and etc. Um, that was one of the worst parts because the pain was a lot for me, but I don't think that's very common. I don't think it's supposed to be that bad, but for me that wasn't great. I had that for about I want to say 2 weeks probably, and once that got out, like they took that out, it was a lot more comfortable. But for those 2 weeks, it was rough. I mean the IVs weren't great, but it wasn't. It was. I don't know. I dealt with it. Like it wasn't the pump. The drain was the worst for me. And then I had to stay in Pittsburgh. Most facilities or like doctors want you to stay in the area for, I think it's like within maybe 10 miles of the area for about a month to 2 months. I was able to get out about a month and a half, not get out, but leave to go home about a month and a half after my transplant. I lived about like 3.5 hours away, so we wanted to really be sure. I could have left probably 2.5 or 3 weeks after, but I didn't want to rush it. So we went back a little before Christmas, so like the middle of December. And then for my doctor, I met a month. Well, for the first, while I was there in Pittsburgh, I met about every 2 days. Really early in the morning, they did blood work, and then they gave me any medicines or infusions or anything they had to give me just to make sure everything was okay. And then after the first maybe 2 weeks or so, it dropped down to like every 3 days, I think, and then it was every week. And then once it got to, I think maybe every week or every 2 weeks, that's when they gave us the option to go home. We didn't go home until it was every month. So I went home just like December, um, went back the middle of January, and then I think from there, maybe it was every 3 months. Then it went out from there. Anything else, I have to get blood work done. So that was something I had to do prior, or no, sorry, after. Um, so about, I think it was every week. And then, well, once I was out of the hospital, out of doing all of those appointments, I think it was every week I had to get blood work that they followed me. Um, and then I think it was maybe every 2 weeks that was probably a long time. Like I might be forgetting, but I think it was every 2 weeks until maybe like this past June. So like over a year out. And then now I'm every month. And I think normally they try to keep it every month for a long time just so they can make sure that nothing's going on. And then other than that, I have to go back. For me, it was like every month, every 3 months. And then I think it was every 6 months. And then like on the year, and then year and a half. And now I went back the end of November, and then I have to go back. No, no, I'm sorry. I didn't go back. This is November. No, I didn't go. I'm not going back until January. I went back in like August or something, and then I scheduled for it would be for my 2 year, but it got pushed back to around January, so that would be my 2 years. So yeah, I
So we'll
don't
have to
think.
follow up to make sure that overall your
Yeah,
liver has accepted and that you're doing well. It seems
right.
like it's not like, here's a new liver, you're on your own.
No, it was a lot of um follow-ups, they were more relaxed than I was. Um, I was just luckily doing well that by Thanksgiving, they were like, okay, you can go home. And I was like, I'm not going home. Like, that's insane. So I stayed longer than they wanted me to, but it was more like they were fine with me. Just like, even with the drain, they were like, they just let me like go with it. And I was like, I worry all the time. So I was like, that's crazy. But I was with it like in the Airbnb we had until they took it out those few weeks later.
Got it. Wow. Casey, thank you for sharing your personal experience. And you went into depth. Thank you for sharing how you felt through it too. It just confirms that it is completely normal that we might feel scared, perhaps, worried as we go through this process. It's not like, oh, okay, I'm just going to go buy something up the street. It's something that's being done to our bodies, of course. It's completely okay for us to feel the way you validated that it is completely okay for us to feel the way that many of us would probably feel in the middle of that process. Thank you for that, Casey. I really appreciate you. All right, now we're going to go ahead and hear from Ashley as well. Ashley Silva also underwent transplant, and she is an EPP patient.
I am. So obviously I've had EPP my whole life. Um, one of the lucky ones. Sun sensitivity, the whole nine. My mom's not a real big doctor fan. So growing up, there wasn't a push to figure out what it was. It was, I'm sure people have heard me say this, it was crystal grids and herbal remedies and don't drink the orange soda. It lives in my head rent free forever. Now you guys have to suffer with me that we're not allowed to drink orange soda because my mom said so, although that's not the reason. It just sticks. So fast forward, November of 2023, I had started feeling some abdominal pain. I am a mom. I have things to do. I just kind of ignored it and hoped that it went away. It did not. It got progressively worse. I started to become jaundice on Thanksgiving Day of 2023. My husband convinced me to go to our local emergency room in Fall River, Massachusetts. I was trying to make Thanksgiving dinner and was doing horribly at it because the pain was just so intense. So we went to the emergency room. I was there for 8 days. My bilirubin, LFTs, all of that continued to elevate. They did whatever they could think to do there at our local hospital. So a lot of testing, not really much found. They wanted to do a liver biopsy, but that was kind of outside of their scope. So they transferred me to Tufts Medical Center in Boston. So I went 8 days in my local hospital. Now I'm at Tufts. It's December 1st-ish. They did a lot of testing. They did my biopsy. The night of my biopsy, I was in my room back recovering and I started bleeding internally. That went very wrong very quickly. I had to receive a lot of blood. Again, a lot of testing that wasn't finding anything. The pain was still very much there. That's the one thing I remembered is just the pain. It was a constant. It felt like that side stitch you get when you run too much, but like times a million. And it just didn't stop. It felt like I was being shredded from the inside out. So I was at Tufts until November 15th when the powers that be somehow got a hold of Amy and Rebecca at MGH, my absolute saviors. They moved heaven and earth and had me transferred to MGH in a matter of hours. I still do not know how because they were on a no transfer order. So MGH was not accepting outside patients. But they had me there in hours. And that's when the real work began. So we started the testing, the genetic testing. But Amy already knew that's what I had because she had it. She was looking at pictures, looking at everything. She's like, she's got EPP. We got this from here. So we started Heman. We started all the meds. We did the workup to have me put on the transplant list because at this point it was shot. It was done. It was not doing its thing anymore. We did plasmapheresis, the whole nine, limped me along until I got better enough the end of January. So I spent 64 days in the hospital. Got well enough to go home while waiting on the transplant list. I continued to travel to Boston twice a week to have heme transfusions. For me, that's about an hour and a half, 2 hours, depending on traffic. So not terrible, but not fun either. Um, so lots of heme, lots of blood, lots of stuff, lots of meds. And then I got my phone call on June 20th, around 4 o'clock in the morning, that there was a transplant available. I had to get to Boston immediately. And I don't think I've ever gotten to Boston faster, to be honest. So my phone call came at 4 a.m. and I think I was in the operating room by 8 a.m. It was real quick and it was a whole lot happening all at once. Um, but I woke up and like Casey had said, they initially told me I would be in ICU, basically in a medically induced coma for several days. Jokes on them though, because I don't have time for that. And I was FaceTiming my husband and I think eating ice cream or a popsicle or something that night. Like I just don't have time to be there. So I actually was in ICU for about 24 hours, maybe a little bit more. I don't really remember. I had a lot of really good drugs. I had a button. It was great. So then I went on to the transplant floor. I was there until July 3rd because, again, I had things to do and I had missed every prior holiday. I had spent every holiday at Hotel MGH, and their food is awful on holidays, even though it's special. I didn't want it. I wanted to go home and watch my fireworks at home. And so they agreed, maybe reluctantly, I don't know. They let me go home on July 3rd. I did end up back in the hospital the following week, just because things were not quite settled. So during my initial, right after transplant, my levels were not, it was not settling the way they hoped, and my levels were going up and not back down. So I had to have an ERCP, which is like a little stent thingy. I'm not good at the medical stuff. So, like, you have to ask the smart people the terminology, but they put this thing in there that made the stuff go through the thing because my thing and their thing were not the same size. That's what I understood. So they had to go in there and put a stent to open it up so the stuff could flow. Once that happened, I really did take I turned a good corner. And I remember even mentally feeling the difference of how much the toxins were starting to build back up in my system and not feeling that clear headed and starting to have confusion and the scary side effects. So I was happy to be turning that corner. Everybody was very relieved. I got to go home, but then I did come back again just for a couple days because I don't got time for that. I think they just wanted to be on the safe side just to make sure, because I don't know if they really did anything different. They just wanted me there just in case. And that's fine. I went home after that. I've been home ever since. So it is a lot of follow-up work. I do a lot of blood work, not just for the liver transplant side, but also for the porphyria side, because having a transplant doesn't fix it. So we need to protect my new liver. So we're constantly monitoring, looking at my levels, seeing what that looks like. We have discussed bone marrow transplant as our potential next steps. That's a hard stop for me right now. Very hopeful for some potential treatment options that have been submitted, and we are all praying for that Christmas miracle. So hopeful that will help. So that's been kind of my experience with the transplant. It's not a great time, but it's provided me a life I never thought possible, because although I have EPP, I now know that I have EPP. And so now I do have treatment options. So I do get Sines. I did just get back from Disney. I go watch my daughter at softball. I am outside living like a sort of normal person, and that's really exciting. So, I mean, it's definitely scary, but I'm very grateful that I have an amazing team of doctors, both porphyria doctors, but also, liver and the total health. And I'm lucky that they're all in the same place and they communicate very, very well. So that's kind of my story.
Ashley, thank you so much for being so vulnerable. I don't think many of us, like, we're so beyond thankful that you can be so real and say, I was scared completely through this whole entire process. But I knew that there was another life waiting for me as well. And you've highlighted that it was scary, both of you have, but while it being scary, you still did it because it's what you needed to do. You needed to be brave for yourself and for your loved ones as well. So thank you. Thank you for being so vulnerable and sharing that. Is there anyone else here that, and take yourself off mute, if you have undergone transplant? I would love to hear your story.
I'm an AI peer who had surgery.
All right,
I
Molly,
don't know
share
if
with
you,
us your story. Welcome.
yeah, so I'm actually, I believe the person that Amy was talking about with the AIP transplant. I didn't prepare anything, but I was jotting down notes to maybe share, just sort of what my process was. I found out I had AIP because I have my aunt and uncle had AIP as well, or have it. Um, so it was sort of like it was already diagnosed in the family, and then they were trying to figure out who might have it, and I fit the criteria. And after I had my kids fairly close together, but through each of those pregnancies, it was pretty rough. Yeah, so I had a lot of problems with my pregnancies just because they couldn't really figure out what's wrong with me because I was having all these symptoms that they didn't know. So after my daughter was born, my youngest was born, I ended up getting the some type of AIP testing. It was only slightly elevated. So at that time I had a newborn and a 2-year-old. So I was like, I can't deal with this right now. But later on, symptoms started getting worse and worse. And sort of looking back to my 20s and teens, I was like, oh, yeah, that's probably what it was. But they finally diagnosed me when probably 10 years ago, I think. But I also had been diagnosed with polycystic liver and kidney disease during an ultrasound for my son, my oldest. They sort of scanned over my liver by accident, and it was like Swiss cheese, kind of just all all cysts. So I found out I had the kidney and the liver disease, and then about 5 years ago, my liver just started growing uncontrollably. So I looked 9 months pregnant when I ended up getting my transplant because of the size of my liver, and it was just also smushing my kidneys. It was um, on my CT scan, you can sort of see it was right under my heart and went all the way into my pelvis. So it was giant. I think it was 30 pounds when they took it out. Um, and yeah, so I had been like my family knew about all this and they were seeing the symptoms throughout the years of the AIP and the liver, just the size of my liver. And my sister was always saying, if you need a liver, I've you got mine. And so she doesn't have the cysts and she does not have porphyria. She got tested for both of them just to make sure. So she was good to go. And there was a long process to get her to get like from the initial call. I think actually it was 4 months, so that's not very long in comparison, but it was about November to March. March of this year is when I had my liver transplant. So my sister gave me 60% of hers, and they took all of mine out and gave me that 60%. So we're both growing livers right now, but um, overall, it's been really great. I can see my toes and touch my toes, and I I can do a lot of other things. It's hard to tell really like what the abdominal pain and my API symptoms, which one of those was the liver being giant and which one is the AIP, but now I sort of am figuring it out as some of those symptoms are going away. Like I had always had like IBS symptoms and those completely went away. Like I'm surprised by how quickly I feel just good about like good and able to eat whatever I want. Yeah, and the spasms that I used to have abdominal spasms and spasms in my back and my neck and my legs. So those have gone away because I remember always telling the liver doctor as my liver grew, I was like, I still have like intense pains in my abdomen. Could that be my liver? And they kept saying, no, it's not your liver. It must be the porphyria. But um, yeah, so I guess just a quick thing about my surgery. It was it was really scary because you think um it basically they sort of told me that I got to pick when the time was right. So it was sort of like, okay, your liver's still functioning. You probably don't want a liver transplant now. This was 5 years ago. And then each year it was like, okay, now I can't bend over. I can't do the things I want to do with my kids. I can't run. Then it became, I can't eat anything without it hurting, and I'm losing a lot of weight, and I need to get something done. And they sort of talked me into like it being my decision, but that they said, "Well, where do you see yourself in 5 years?" And I was like, "I want to see my kids graduate high school, but I don't see that happening with this liver." So I ended up getting the transplant in March, and I feel now that I can plan ahead more, which is just the best thing, is just saying like, yeah, if all goes right, I'm going to be here for that, and I'm going to be here for that. And before it was sort of like, well, what is it gonna, if it feels this way this year, what's it gonna feel like next year? That sort of, or a month from now, really. Um, so yeah, it's been overall good, but as the other two people said, a liver transplant is not fun. Like I knew I was doing it for a purpose, and that's sort of what I kept in mind, but you really have to stay positive about like, okay, I can do this really hard thing. I can deal with this much pain. It's only temporary. So I feel like that really helped me like stay in a positive mindset. Like this is just temporary and everything's okay. Um, I also needed a stint, so I was there for about 10 days. And they also kept trying to figure out if they were going to send me back to surgery or do an endoscopy to get the stent in. So they didn't let me eat. Really, I wasn't hungry, but they also didn't really let me eat or put me on. I had a GI, I had a tube feeder in my nose, but they wouldn't turn it on because I was potentially having surgery like each day. So, I didn't really get to eat much, so I had to go home with that, and I had to go home with the three. Well, I guess I only went home with two of the bubble things, the drains. Um, but yeah, it ended up being that the stint cured that up, so I could have um, the other drains removed. And I ended up being able to eat once I got home. It just felt so much better. And like my mom cooked me fried chicken that night, and it was the best thing in the world. So I started eating, and I didn't actually need the feeding tube, so that got taken out in 2 weeks because they wanted to make sure I was actually gaining weight and things like that. So yeah, that was sort of mine. Everything's been going well. I did have a stint where I had sepsis in the hospital because of an infection, but that was sort of just something that happened, and now I wear a mask everywhere I go. So just in case.
That's
And
definitely really smart.
yeah, I was starting to be loose, and I was like, yeah, I can eat a buffet at the kids' school. And then that night I was in the ER. I was like, no, no, I can't do that anymore. No buffets, no masks,
That's what I've heard,
all
that there's a
mask in
lot of
schools.
there's
Yeah.
absolute a lot of no-nos, but
Yeah.
you're here and you get
Yeah.
to be here, part of your children's lives, and which is clearly, as moms, that's what we
Yeah.
strive for. Molly, quick follow-up question. Since you were not able to eat during a period of time while you were in the hospital, did that provoke an AIP flare?
No, it did not. And the meds that they gave me, it didn't, I didn't have the med reaction that I always used to have. So that was sort of telling me that things were starting to be good. Well, I did talk to my liver specialist beforehand, and I said this should potentially cure my AIP, and they were like, "No, no, it doesn't work like that." And I was like, "Amy, this is going to cure it, right?" So I got a 2 for 1. So it was really great. My goal, I mean, I had trouble with AIP my pretty much my whole life, and I was on Panhemain and then Gavocerin for a long time, and my veins are all shot because of it. But that wasn't my goal to get the liver transplant. It just helped me make the decision. Um, for each flare up that I had. It was like, well, this could be gone. So yeah, I haven't
Wow.
noticed any symptoms. And like I said, like the IBS that I always assumed was the porphyria because it would get a lot worse during my attacks, that's gone now. And I'm able to eat things I haven't eaten in years, which is awesome. But no buffets. Don't do that.
Well, thank you very much, Molly. You're very brave to just be honest with us, the
No.
reality of how painful this whole process is, but
Yeah.
also we get to see the smile, we get to see you here. You three, thank you so much, Casey, Ashley, Molly, thank you for being so brave to share this. Kristen actually just put something on our chat there as well that really reflects how we all feel. Your stories are so critical, they're so important to us in our community. They strengthen us. They strengthen us in our community. So thank you for that. Really appreciative of you guys being so honest and vulnerable with us. We do have some questions. The first question is an AHP question. I am concerned about the rejection of the transplanted liver. I feel like porphyria patients' bodies are already struggling. Would a new liver be able to settle in?
Yeah, so with any type of liver transplant, patients are on a lot of rejection medications to help decrease the immune system. That's why people with transplants are at increased risk of different infections, like probably why Molly got the sepsis, most likely. So that is a risk with transplants that could body could reject it, but the doctors are very, very good at picking medications and monitoring it very, very closely. And if there's any issues, they do biopsies to look for rejection or other things as well. So, but it's certainly a risk, but I don't think it would be higher for porphyria patients than other types of patients for the rejection piece. Yeah.
Fantastic. This is also another AHP question. I had a biopsy done in my liver. My liver had has some cirrhosis, inflammation, and signs of repeated injury and repair. The surgeon I saw said that he would not do a liver transplant because he, quote unquote, does not do liver transplants for porphyria patients. Is this a common medical opinion? And why would a surgeon be resistant to perform a liver transplant on a porphyria patient? Does it have to be, is it required for it to be a porphyria surgeon?
I'm assuming that patient has EPP, because cirrhosis doesn't really happen typically with AHP from liver, or could happen for anybody could have cirrhosis from other reasons. But for EPP, that's one that can typically can cause cirrhosis and liver failure. It's important to go to a place that has experience with liver transplants and with EPP. There's not very many places. I think some doctors may think that the transplant are too high risk. Um, so um, that may be a way that reason they're resistant, but certainly if they're just blanketly saying no transplants because you have EPP, you should just find a different center. I think some centers have different thresholds for risk and have different ways of evaluating it, but rather than trying to push that one doctor who's not experienced with porphyria, it's probably better to find a place that's more comfortable who would be willing to work with you or who has had some experience with EPP, ideally.
Okay. Is that the same for an AIP, or you feel the same way that we should go to a surgeon that has worked with specifically with porphyria patients?
Not as strong of an opinion for AIP because the liver
Okay,
transplant for AIP is more like the liver isn't failing it per se, and there
right.
isn't as so many specialized porphyria specific therapies around the liver transplant that it would be for EPP, where you do specific plasmapheresis and red cell exchange. A lot of those things wouldn't really apply to AIP. It's always good to, go to a place that has experience with your disease if you can, but it's more of you know, a routine liver transplant for AIP, and probably less risky than other liver transplants because the liver itself is doing okay at the moment for in general for AIP liver transplants. That would be my thought, that for EPP it's more important to go to someplace with experience with EPP and liver transplants, but for AIP it's not as critical.
Okay, perfect. Um, what are the risks? And I know you're not a surgeon, but what are the major risks of something like this? It's a massive surgery. So, what are the risks of a major surgery like this for porphyria patient? Age, be specific, but applicable to all.
Mm. So there's a lot of risks for liver transplant that Ashley and Molly and Casey have all already talked about. They have a lot more firsthand experience. But one thing I did want to mention, especially for AIP, getting a partial liver from the family member, is critical to do genetic testing on that family member, like Molly did. We have another patient at MGH where that wasn't the case. This patient before coming, it wasn't at MGH and this happened, but basically got a partial liver from a family member, and that person had genetically positive AIP, turns out, so that patient continued to have AIP symptoms after the transplant because they didn't check. So definitely, make with AIP, it's very important to make sure, if them not having symptoms is not enough for AIP family members. You need to make sure they're genetically negative. And there's, for any type of surgery, there's risk of um, bleeding and infection and um, bile stricture, like narrowing, and those liver transplants have quite a lot of risk. I'm not a liver transplant doctor myself, so if you're considering a liver transplant, definitely talk to the liver transplant doctor who can go through all the specific risks. But it's definitely not something to take lightly. Yeah, and for AIP, especially people might think, oh, it's great, it's going to cure my disease. It's definitely something that, would need to exhaust all options before considering for AIP, because there are quite a lot of risks to it as well.
Risks associated for sure, absolutely. And a follow-up question to that, specifically by this patient, he says that my care team has specifically told me to avoid major surgeries unless absolutely necessary. Do the pros really outweigh the cons? I think you just answered that, and that is, it really depends. It's not a one straight answer.
Right. And for AIP, if you can get through it, it does cure AIP, but then you have a lot of other, you know, risks from the liver transplant. You have to take lifetime medications. You have a increased risk of um, your Ashley's bottle of medication pack. You have to take, lots of medications, risks of um, infections, risks of side effects from the medications. Um, and there's, is risk of rejection, that's carefully monitored. But from an AIP standpoint, it should be cured afterwards. Some people, if there's chronic nerve damage, it's not going to reverse any, you know, nerve damage that is permanent. If people have like paralysis or that sort of thing, it wouldn't necessarily reverse any previous damage that could be still present afterwards, but would cure the AIP from they cure the recurrent attacks and prevent those from happening.
Um, I'll repeat one thing that you said earlier, and that is you should exhaust every option. And for us with AIP, I include myself in that, is have we tried everything with the heme? Have we tried everything with Givlari? Have you exhausted all the treatment options? Perhaps changing the intervals with Givlari, perhaps, and changing the amount of prophylactic heme. We can't give any medical advice on specifically for you. Your doctor would need to determine that. But as Dr. Young had said, it definitely should be the last thing that you've exhausted every option possible, because it is adding yet another piling on yet another thing onto your health. Our bodies have already gone through so much for sure. Perfect. Okay. Um, this is a good one, and I'm not sure if we can actually even answer this. Let's go to this one first. Is there ever a case that AIP has not been resolved or recovered, even post liver transplant, that you're aware of? Any case?
The main one that I'm aware of is the patient I shared where they had a liver transplant, but the family member had the genetic porphyria. I'm not aware of other cases where it wasn't cured, but there are some people that have, chronic nerve damage for which they can't, you know, weren't able to walk or move their feet, anything like that where it's chronic damage to a nerve. If something's dead, it can't come back to life, essentially. Like those nerves may be, shot and may not be able to recover after a liver transplant. But I'm not aware of any cases where it doesn't cure it. There are some cases where the patients haven't survived from complications of the transplant itself or other things related to it. So it's not always 100% patients are have the life that they want cured uh you know perfectly back to normal afterwards. So there's yeah, but I am not aware of any cases where it wasn't cured.
Okay. Thank you for that. This is a question from a 51-year-old woman. She says, I have AIP stage 3 liver fibrosis. Is this more likely from AIP or Givlari? I have been told different things. I thought cirrhosis coincidence was 10% in AIP.
And there's cirrhosis is not very common from AIP itself. I'm But also from Givlari, it can cause some increase in liver function testing, but it generally goes back down with continued use. So I haven't heard of cases where Givlari caused cirrhosis. So it could be AIP and maybe could have some contribution of Givlar, but I think that's less likely. But I also think it's very important for doctors to look for other causes of cirrhosis and other causes of liver disease, because I think a lot of times when people have a rare disease, doctors stop looking for other causes for things. And so I think that might be important because there might be other contributors like fatty liver disease, which is very common, and other things that might be influencing the liver.
Perfect. Do you know how it is prioritized for any patients for liver transplant? How long is this liver transplant wait list typically?
It can be very variable. It's actually quite variable depending on the state too, because the allocation is state wise. Certainly if you're getting a partial liver from a family member, then it sort of, you basically jump any lines because, it's you don't have to wait in the same line as other patients. Sometimes if the liver is too far gone, though, a partial transplant may not be an option. If the liver has too much failure, sometimes, the doctors may say it's not safe to do a partial liver, that you need a full liver. In that case, there's basically each state has different ways that they do scoring based on how bad your liver is and how sick you are. And so sometimes you have to essentially wait to get sicker before they'll give you a liver. With EPP, a lot of times there are ways to get extra points in the scoring system for a rare disease and to, basically get bumped up the list so you don't have to be quite as sick as some other liver failure doctors. But it's good to have a site that's familiar with EPP liver transplant, so they know exactly how to apply for those extra points and to get you high enough in the list. For AIP, if you're doing it not, there's not another reason for a liver transplant, it can be very difficult to get an AIP liver transplant because the liver itself is fine and you basically have no other points besides the rare disease. And so it's become especially difficult, but there I'm not aware of any recent cases in the US where it's been done for AIP itself, but I think the liver doctors probably have ways to apply for points and to get certain exceptions to allow for that. But if it's not from a family member, I could imagine that the wait time might be quite long because
Years,
it's not like,
probably.
yeah, because it's not like an emergency. And so many other patients, like in emergency liver failure in the ICU who need it right then, would get it first every time.
Absolutely. Would it make sense for the patient to be registered at multiple centers, or does that not really matter?
I'm not sure if people can be registered at multiple centers because I think the wait list is per state regardless. Um,
Okay.
so I, good to ask a transplant doctor about that. I'm not exactly sure how that works, but I did not think you could be registered at different centers at the same time.
Okay. Could a porphyria patient receive either a cadaver liver or a living donor or both?
For um, AIP, either would um, be okay because generally the liver itself isn't failing. So a partial liver is safer for AIP than EPP. A lot of times when the liver is that far gone, um, the doctors aren't comfortable with doing a partial liver due to the risks and um, yeah, so um, in a lot of cases for EPP, it has been done. There was a patient in Canada I know of who had a partial liver from a family member when they had liver failure, and that patient's doing well. So it can be done, but it somewhat depends on how bad the liver is at the time of the transplant and a lot of other factors. Each liver transplant center would have to decide what they're comfortable with. So it may not be, both may not be an option for every patient.
Got it. Okay, perfect. So we have the next 17 minutes, and I thought instead of going through the next couple of questions, we only have three more questions left anyhow. We could just leave it open, let any one of you guys take yourself off mute and ask either the doctor or one of the three patients that are here that have undergone surgery, ask them any questions. But I will be keeping an eye so that we can be out of here within the next 17 minutes, though. So ask away your question, take yourself off mute, and you can feel free to ask any of them your question.
I actually have a question. You guys said a few times that a liver transplant at AIP can cure porphyria. I don't know exactly what you're talking about. You meaning no attacks ever again in life? I don't really understand what
Yes,
you
that's
mean.
how it works for AIP because the problem, the enzyme problem is in the liver. And so for liver transplant afterwards, there may be other complications, but there's no AIP attacks afterwards.
Oh, okay. Like I said, I've only been diagnosed going on 2.5 years, and I've never heard that from my doctor or anybody. So
Hmm.
that's exciting. But also listening to all the side effects of having a liver transplant, I don't know if I want to have to deal with that.
It's a
I'm
lot to
used to
consider.
I'm used to AIP. I've lived with this pain my whole life. This is my norm. This
You
is
don't, you
normal
wouldn't
life.
even know what to do without all that pain, sis.
Yeah. Mhm. But then the risk of a liver transplant, that scares me.
Hmm.
It
Yeah,
is.
it's appropriate to be scared of a liver transplant because it is, a very big thing. So probably Molly and some of the others can share more about
Yeah.
what it's like.
It's terrifying, but in the same way your AIP pain is your daily life now, like it does
Mhm.
eventually become like this is my daily life now. And I
Yeah.
have like my alarm goes off at 9, 2:30, and 9. And
Okay.
I'm very grateful though, because it's been reduced a lot. Like when I went home from the hospital, I called it second breakfast and second dinner, 35-ish pills
Wow.
down the hatch
Yeah.
twice a day, plus some in
Well,
between.
and I guess my other concern, my husband has MS, so I couldn't get a liver from him. Most all my kids have porphyria. So me having AIP, it would be a waiting game.
Yeah. Yeah.
So
It was we had looked at potentially doing partials in my situation, and we
mm,
had my sister, and I have an older son, he's 21. We did genetic testing on both of them to see if either of those would potentially be a match, and they were not, unfortunately. And I have a very small family, so it,
yeah,
by the graces of whatever you choose to believe in, I had an amazing team of doctors who applied for all the exception points that they could possibly find for me.
yeah,
And I was able to, now be out here doing things. So,
yeah.
but
That's awesome.
I didn't have a choice. It was either do
Yeah.
that or die. So,
Well, and I've just been wondering about it because I know it's something that people do. They get on the list earlier. And so I guess I'm just at that point of should I get on the list? My liver right now, it's a little risen. It's not much. It's still doing really, really good. But it is raising. My numbers and my liver enzymes are raising. Um, and they have raised in a really bad attack to really high before. So maybe I'm just in the beginning, maybe just to talk to my doctor and just see what he thinks.
It's always worth a discussion, I believe, for sure.
Yeah.
totally.
Yeah.
Thank you,
But yeah, I
Ginger.
never heard that it could literally take away a port. I mean, that to me is mind blowing because since the day I was diagnosed, I thought this was life forever. So that's kind of like when you guys kept saying it, I was sitting on the patio and my husband was listening and he said, "A cure?" And I said, "Yes." I mean, it was an exciting thing to hear, but there are risks with it. So
For sure. Ginger, thank you for sharing your thoughts with us,
yeah,
and welcome to our community. Super proud that you're here with us.
thank you.
All right, Gunja, we're going to go over to you.
Hello, everyone. Thank you for sharing your stories. I think I was having a mindset that maybe I want to go for liver transplant one day, but I'm responding very well to Givulari. So, and as the risk mentioned, I think it's not an easy thing. But my question for doctor is, have you come across a case where a patient is not responding to Givulari and hence Givulari and panhematin very well, and that's why they got liver transplant?
Mm.
Um, I'm not aware of any recent cases of liver transplants for that reason. I certainly am, have patients who have been on Givlari who also needed
I'm
Heman on
on
top of
oxygen
that
now.
and continue to have some symptoms as well. So I know of certainly in the US before Givlari, there were a lot of patients on Heman who had liver, not a lot, but some patients who had liver transplants and cured their symptoms. Some people had, if they had a lot of neuropathy, they didn't, they continued to have symptoms from that. But, Molly can share her experience with uh, Givlari and Heman and the liver transplant. Obviously, liver transplant wasn't for porphyria in that case, but the effect was still curing the porphyria. I'm not sure if that answers your question or not. I don't have that specific case in the U.S. where people were on Givlari and Heman and had the liver transplant from that reason. Myra, you might know if there's cases in the US of that.
I actually have spoken with two other Porphyria sisters of mine because I'm in the process of undergoing the liver transplant evaluation right this second as we speak, actually. And they both of those EIPers that I wish they would have been able to make it here today. In their case, they had both heme and Givlari. They weren't getting any better as a result of those treatments. They had exhausted both options. They had changed the intervals. They had done everything you can possibly imagine. The treatment was simply not working. They opted for the liver transplant and they're cured, they're healed. They never have had another attack in their whole entire life. One was 59 when she had it done. The other one was 31 when she had it done. And it's been over 20 years. And her body, for the one that was 29, has actually accepted. I'm sorry, 31 has accepted fully well and is no longer even on the pills except for one at this point, unlike, Ashley started with like 30 whatever. So eventually your body can think that it's just your own organ. And that's the goal, I believe, for every single one of these situations, right, Ashley and Molly, both of you guys, that's what you've been told, that that's the goal to get to that point.
I don't think there's any situations if people only have a liver transplant where they would get off rejection medications ever. They may be able to go down to like, one pill, but there are some situations if people have both a liver transplant and a bone marrow transplant where you might be able to get off all pills, but that might be a specific situation.
Yeah.
Mhm.
Yeah, I
Amazing.
can. Oh, sorry.
Oh, sorry. Yeah, so I
Oh,
think my question, yeah, you did answer my question,
oh,
but my question more specifically, now that I think back, it's like, do you have to be like really, your liver has to be damaged badly in order to like get into the line above the line for liver transplant, or you are not responding to Givlari and panhematin and suffering a lot because of the pain and all the symptoms, and so they will consider you, or your liver has to be really damaged. Like, what is?
the liver doesn't have to be damaged for AIP because generally it's not for, um, you know, transplants if it's for AIP. But I think Molly had a comment or response to what Gunjan.
Just going to say that, well, uh, I was going to respond initially to your Panheman and Givlari. I was on Panheman I was on it at first for monthly doses, and then they brought it up to every 3 weeks, and then it was every 2 weeks, and then it was sort of like you get Givlari for you get Panheman for 4 days, you wait 2 days, and then you get it again. So it was sort of like um, never-ending Panheman, and my veins it got to the point where I had a port because I couldn't find a vein that worked anymore. But Givosiran did work for a while, and then I kept getting the symptoms. And then it became, again, like I could go 2 months without any symptoms. And then it was every month I would get symptoms the week before I got my injection. And so it was sort of like a progression of, well, are these pills going to last for, like, am I going to be on these injections forever? And they did change the doses and they changed the frequency, but it didn't seem to completely get rid of all the symptoms. But then I also wanted to say that even though I had an additional matter that caused a lot of the reasons that I had the transplant, that my liver wasn't unhealthy at the time of the transplant. They still considered me very healthy. And the only reason, but I did get on the UNOS list, even though my sister was going through the process. That took about 4 months. So in the meantime, I was on the UNOS list, and they told me that I got fairly high on it because they had gone for the exception points, like the quality of life, the pain, the daily pain, the chronic, that you've been dealing with this for so many years. And that really helps that, I mean, they said it might be hard, or initially they said it might be hard because I wasn't, my liver wasn't sick enough. They basically told me to wait till it's sicker and then, or basically wait till your kidneys fail and then we'll give you a liver transplant. But um, yeah, it did end up that I was on the UNOS list. And and I got quite high up on it because of the quality of life was bad. So I wasn't as emergent as both Ashley and yeah, I wasn't it wasn't an emergency that I get one that day, as it is in a lot of cases, but I just wanted to tell you that you still can get on the list and it's still possible to get a deceased donor if you wait.
Thanks, Molly. That's
I hope
helpful.
that helps. Sorry.
Okay, guys, we've come to the end of our time together. This was fantastic. I hope that your takeaway has certainly been that while it is a very scary option, it is an option, and we're blessed to have an option. There are so many other diseases that don't have anything, and at least I'm grateful that we have the constant research that's going into situations like this, and we have plenty of doctors who are experts in the field as well who could help us answer those questions. I saw a note in here from someone else that would like to essentially have a conversation with one of the expert doctors. If you reach out to Erin at porphyria.org, she is our patient navigator. She is the expert at being able to make that perfect match to ensure that you have every single expert at your fingertips so that we're able to ensure that your questions are being answered. But Dr. Dickey Yeung, thank you so much for being with us, for giving us your knowledge, not only to you, but also to Molly, Ashley, and of course, Casey. Thank you so much for giving us your thoughts, your opinion, your vulnerability, and sharing with us what what you guys experienced. It's not easy to put into words oftentimes what we experience, but you did a lovely job for not only being so fully honest and transparent with us, but also holding back probably some of those tears that probably inevitably wanted to come out because it's not easy at all. I am going to have Anna help me wrap up by putting up our slides. We have a couple of things that are actually coming up in our community. I don't know if you have it, and I didn't even get a chance to ask you earlier, but we do have some events coming up. We have oh, there they are. We have on the 10th of next month, we have an expert doctor that's going to be talking to us about nerves and porphyria, Dr. Cozumel.
Oh,
This
that's
is
good.
a reschedule from a unfortunately a most recent hiccup that we had that he was supposed to be with us and
I
he had
want
a
to do
family
that.
emergency and was not able to be with us. But this one you do not want to miss. He is an expert specifically on nerves, but happens to be an expert in acute porphyrias as well. So please join. It's going to be a fantastic one. Additionally, aside from this event, we have, of course, all the connect ups that we have on a monthly basis. We make sure that we come together as a community. If you would like to have a one-on-one with one of our ambassadors, we make sure that we have people readily available for you to talk to them one on one. There should be no reason why an individual should feel alone. We have it hard enough with this disease. We do not need to feel alone. So we have an ambassador program that allows us to be able to connect, but also it's expanded beyond that. It's also a volunteer program. If you would love to be able to volunteer your time and donate some of your time, please reach out to me. I'm the one who oversees this particular group, and I would love to be able to plug you in and some of the fun things that we have coming up specifically for the holidays. And lastly, as I mentioned, our patient navigator, we do have that one-on-one support with a patient that can connect you with an expert as well. Also, do us a favor and sign up for our e-news. We make sure that we send out specific news to encourage you on what's happening within our community. We also want to make sure that if you have any questions, that you stay in touch with us. We have Katri Para, who is always looking for stories. If you would love to share your story with us, we would love to be able to get you to share your story specifically because we are all unique and we are all special in our own way. So I would love to be able to share your story, and you can send your information to Katri at porphyria.org. That is it for today. Enjoy the remainder of your weekend. Have a beautiful night, and we will see you at the next one together. Okay? Have a good one. Take care. Bye.